So now let's see the bioassay of vasopressin. So what is this vasopressin? Vasopressin is also known as antidiuretic hormone. So this is the natural hormone which is produced in our body and it is secreted by our posterior pituitary gland, and the use of this vasopressin is antidiuretic activity and as well as vasoconstriction. Vasopressin, vaso means vessels, it will show its activity on vessels, so it is used as a vasoconstrictor also. In medically, why are we using this vasopressin? We use this vasopressin as a pharmacological action to treat the upper esophageal bleeding and diabetes insipidus. So if we are giving to this upper esophageal bleeding, then we have to give 20 units per 15 minutes. Okay, and if we are giving for diabetes insipidus, then we have to give dose 5 to 20 units for 4 hours. We have another analog of this vasopressin, which is desmopressin, and when it compares to vasopressin, it will show equal effect as vasopressin. So this is same as our natural hormone vasopressin. So when we are comparing with other antidiuretic drugs, this desmopressin will show equal action as vasopressin. Okay, that's why we will prefer this desmopressin along with this vasopressin. So let's see. So the route of administration for this diabetes insipidus is nasal spray. So we will give this nasal spray as a nasal spray so that we can maintain the therapy. So let's see the type of assay we are doing. So we are doing 2 into 2 randomized graded response assay. So let's prepare this vasopressin. When we are preparing, first we have to prepare standard and then we have to prepare the sample. So let's see the standard one. First we have to prepare this vasopressin and along with this human albumin and citric acid, and we have to freeze it. So if we are taking 1 ampule here, this will contain 8.2 units of vasopressin. So 8.2 units means 1 unit consists of 0.05 mg. Okay, then how much this 8.2 units? So this will be 0.41 mg. Okay, so totally you will be having 0.41 mg of this vasopressin. So let's see the methods we are using in this. So the first method is rat blood pressure method, and the next method is antidiuretic activity in rats. So let's see the first one. We have to take in this first method, rat blood pressure method. First we have to take 20 rats and we have to make them 4 groups, 5 in each. So then and the weight of the rat should be 300 grams. So first we have to anesthetize this rat with 1.75 ml per kg of 25% of urethane, and we have to give this drug through IP. IP means intraperitoneal. So after giving this drug, intraperitoneal drug, we have to treat it with 1 mg of hexamethonium. So what is the function of this hexamethonium? It is a ganglion blocker. So it will produce a so after giving this drug, this rat will produce a baseline. Okay, steady baseline. Then we have to cut open the neck. Okay, and we have to take this jugular vein and we have to cannulate it for injecting drugs. Okay, and we also should take this internal carotid artery for recording our blood pressure. Next, then after taking this jugular vein and after cannulating this thing, this is the jugular vein and we have to cannulate here. So you will be having 3 ways. Okay, for injecting it will be very easy, and like again you have to take carotid artery also. With this you will record the BP. Then you have to give standard drug and test drug like S1, S2, T1, T2 and S2, T1 and S1, T2. Okay, we have to give as 2 into 2 bioassay. So first we will start with 0.1 ml and 0.2 ml, 0.4 ml and 0.5 ml. Okay, we have to give these dosages, and we should also give standard dosages which will range from 6 to 10 micrograms. So next one is we have to, after taking this one and after taking the results of this one, means test and sample, we have to calculate the both and we have to see the relative potency. So next one is anti-diuretic activity in rats. So first we have to take a rat which should be between 250 to 300 grams. First we have to give water to it, 500 ml per 100 grams, and then we have to anesthetize this rats, okay, with oral dose of ethanol, like 2.5 percentages of ethanol, and then we have to cannulate the urinary bladder to collect the urine. And not only that, and also you have to cannulate the tail vein to inject the drug. So we will inject from the tail and it will show effect on. Why we are injecting in tail vein? Only because for rats in tail have so much of vascularity, so you will find so many blood vessels in tail. That's why we will give in tail vein only. And then water is administered orally, same amount, 5 ml per 100 grams. Then standard dose and test dose are injected, like through our tail vein they are injected 2 into 2, S1, S2, T1, T2. Then next dose S1, S2, T2, T1. Okay. So the one which will receive less dose will receive high dose now, and the one which will receive high dose, it will receive less dose. And after that we have to compare all this. We have to calculate this 2 into 2 bioassay, and then we have to see whether the drug have shown this antibiotic effect or not. So this is our antibiotic hormone.